My mother had breast cancer in her early 60s. My oldest sister, who's 12 years older than me, when she was in her mid-30s, had breast cancer.
Sheila Garrett always received an annual mammogram, but just recently decided to do genetic testing.
My genetic testing came back that I have the BARD1 gene, which is a new gene they don't know a whole lot about.
Doctors recommended that Sheila have an MRI to look deeper into the breast tissue.
Probably about 3 or 4 weeks later, I had the MRI, and the results of it showed a 9mm mass.
Patients like Sheila who qualify for a genetic test first fill out a questionnaire about their family's medical history.
We're looking for a pattern of cancer in a family, and a pattern on one side of the family specifically, meaning that one on each side doesn't really matter. It's going to be a genetic mutation that's passed down from either your mother or your father.
A saliva or blood sample is taken and sent to a lab, looking for genes that could impact a person's chances of developing cancer.
So we're looking for, say, 2 or more breast cancers in that family under the age of 50, or 1 under age 45, or we're looking for any ovarian cancer in the family. Then there's a whole host of other tumors that we know are associated with certain genetic syndromes, and so we want to know if those are present as well.
If we do the testing and we do find that they have a BRCA mutation, then we really discuss 3 options with them. Number 1 is just much more aggressive screening. Instead of doing once-a-year mammogram, we will also do a yearly mammogram and a yearly breast MRI. We also talk about chemoprevention, having them take a pill like tamoxifen or a pill like letrozole, which actually blocks their hormones. And by taking that for 5 years, we can dramatically decrease their risk. And then there is actually some women elect to to undergo bilateral mastectomies.
But if your genetic test comes back negative and you have a family history of cancer, you still need to be vigilant about your health.
Just means we have a certain body of knowledge right now in 2017. Certain mutations and syndromes we know about, so we're able to look for those. There may be others that we don't know about.
So what do you say to patients who don't want to do the test because they don't want to know the results?
I strongly encourage every man and woman with their medical history in the family to at least hear about what their options are, and then they can choose not to do that.
The results are also important for your children, as one East Texas cancer patient discovered when his genetic test came back positive for the BRCA mutation.
We brought in 2 of his daughters because there's a 50% chance that each child would have it, and both of those women, who are in their late 30s and early 40s, had a BRCA mutation. So now they're undergoing all the appropriate screening, and they've both elected to be fairly aggressive with their prophylactic surgeries.
Because I did this genetic testing, we caught my cancer at stage 1. And if I hadn't have done that, what if I'd waited a couple years to do another mammogram? It could be, stage 3 or 4 by then.
Sheila recently completed chemotherapy and plans to have a double mastectomy and reconstruction. She also hopes her daughters will do genetic testing.
And if they can catch it early and have the options there are today, it can save their lives and save them possibly having to go through chemo and radiation and that type of, treatments.